Today I'm going to talk about understanding the basics of diabetes and insulin resistance. So let's look at the history. Diabetes was first appeared in written language in the Hindu and Egyptian texts in 1550 BC, but it took the Greek physician Apollonius to coin the word diabetes, which meant siphon. Other Greek physicians called diabetes melting down of flesh and limbs into urine. Gradually the word mellitus was added, which means from honey, to distinguish it from diabetes insipidus, which has a rather bland urine. Sushruta, an Indian physician who lived between 400 and 500 AD, noticed that there were two types. There was a type that mainly occurred in the youth. It was uniformly fatal and the children seemed to waste away. And then there was an adult type which seemed to occur in obese adults. So Edward Sharpie Schaefer in 1910 identified that insulin came from the islets of Langerhans in the pancreas, and he coined the word insulin, which means from an island. It then took Banting et al. From the University of Toronto in 1921 to actually isolate insulin from the cow's pancreas, and together with Eli Lilly they produced it, and it was a miracle drug and saved many thousands of type 1 diabetes lives. Frederick Sanger from the University of Cambridge, finally in 1958, he nailed down the formula and enabled people to biosynthesize it. And it became so famous, people even wore tattoos with a formula on it. Diabetes has become an epidemic in just one generation. No, actually it's become a pandemic. And if you look at this graph of China, you can see that in 1980, 1% of Chinese had diabetes. In 2000, it was 5.5%. 2007, it went up to 9.7%. And now it is 11.6% of the Chinese population have diabetes. That represents 110 million people. The USA has a similar curve, if not that it was over a longer period, and their diabetic population is 11.2% of their population. 40% of them are pre-diabetic, which puts the figure over 50%. So what were the roots of this epidemic? Well, in the 1950s, healthy Americans, mainly men, started having heart attacks. And although the real cause turned out to be smoking, fat was demonized. It was demonized on absolutely no evidence, only epidemiological trials that turned out to be very flawed. Zoe Harcom has written her PhD on this very subject and explains in detail what actually happened. Many of her papers are published in peer-reviewed journals, and Nina Teicholz wrote The Big Fat Surprise, which outlines the whole story. This is a long story and a subject for another video. Anyway, as a result of this, the SAD diet was born, the Standard American Diet. The Standard American Diet is 60% carbohydrates, so lots of grains, lots of bread, lots of starches. And people before this knew that starches were the cause of obesity and ill health. But now suddenly these starches became healthy, whole grain, low-fat foods. The obesity epidemic followed straight away, and about 10 to 20 years later, the diabetes epidemic followed. The official body for advising on diet is the U.S. Department of Agriculture. The very same people that actually sell the food. That doesn't sound right to me. Let's have a look at diabetes. Type 1 diabetes, which is about 5% of people with diabetes, no insulin is produced by the pancreas. It's thought to be an autoimmune disease that stops the production of insulin. So you get hyperglycemia, you get cell starvation because glucose cannot get into the cells. In type 2, which is 95% of diabetics, there's plenty of insulin, there's plenty of glucose inside the cells, but because of the excess sugar, it's a kind of an overflow disease. You also get a hyperglycemia. And type 2 diabetes is not an autoimmune disease, it's a dietary disease and is reversible with diet. So in order to understand what's going on here, let's have a look at some of the main functions of insulin. Insulin is a storage hormone. Insulin is a storage hormone. It facilitates glucose uptake into cells and thus lowers the blood glucose. It aids glycogen storage in the liver. It inhibits fat breakdown and it helps turn glucose into fat. It turns on DNL, de novo lipogenesis, in the liver. So it stores fat. So let's have a look and see what happens if you've got no insulin. In the normal case, on the left here, you see that the glucose is taken up by insulin into the cells, and there's a moderate amount of insulin in the blood and in the cells, and everything's ticking along normally. Now, in a type 1 diabetic with no insulin, there's lots of glucose in the blood, you get hyperglycemia, but there's internal cell starvation. So this is what a type 1 diabetic looks like. This is a patient of Banting et al. In Toronto before and after they gave exogenous insulin. These little children used to waste away and die, and insulin became a life-saving drug. That's certainly not what's going on here in type 2 diabetes. In type 2 diabetes, you've got an overflow disease. You've got too much glucose in your blood, in your cells, everywhere. So your insulin is high, your glucose starts getting higher, and de novo lipogenesis occurs in masses in the liver, and you get a liver that looks like this, a fatty liver, which makes insulin resistance even worse. So we start off with the excess of sugar. You've got high glucose, high insulin. We know chronically high insulin causes obesity. Okay, all the sugar can't be used, so it goes to the liver where you get de novo lipogenesis. Triglycerides pour out of your blood because the liver can't cope. Then you get a fatty liver. Then the fatty liver and the high insulin makes the insulin resistance even worse. And now what happens in the pancreas, you get toxicity, and there's no inhibition of glucagon. So glucagon is high and forces glycolysis and gluconeogenesis, which pushes your blood sugar up, and this circle goes round and round. And now we add the presence of fructose, which is even worse than normal carbohydrates, because fructose can only be metabolized in the liver. And fructose is 5 times more potent at causing fatty liver than glucose. And therefore, fructose is 5 times more potent at causing insulin resistance. That's what we think happened in China. The Chinese used to eat a lot of rice, a lot of glucose for many years, but their diabetes incidence was low. And then from 1980, they started with processed foods, lots of sucrose, which is 1 glucose and 1 fructose, lots of high fructose corn syrup, and their diabetic epidemic took off. Let's have a look at metabolic syndrome, which should be called insulin resistance syndrome, because that's what causes it. The first thing is a large waist, which signifies abdominal obesity, but it's really just a reflection of how much fat there is in the liver and the pancreas. You do get metabolically healthy obese people that have no fatty liver and no fatty pancreas, and they are metabolically healthy. The next thing is high blood pressure, and we'll go into each one of these and explain how they exactly occur. High serum triglycerides. Notice that nothing about LDL here. Low serum HDL, and a raised fasting blood sugar. So the first component of metabolic syndrome is abdominal obesity. So what happens? It's too much glucose in the diet, leads to high insulin. Your glycogen stores are full, so you turn to DNL. You're making fat in your liver. And fructose makes this 5 times worse, as I've mentioned it. And finally, the liver is full of fat, and the fat spills over to the pancreas. You get fatty pancreas, and now you are unable to produce enough insulin, and you get full-blown diabetes with hyperglycemia. Just to mention that about 20% of obese people are MHOs, metabolically healthy obese, which means they have a low fasting insulin, a low HbA1c, there are no markers of fatty liver, and so on. But about 60% of normal weight people, who we call TOFIs, thin on the outside but fat on the inside, are metabolically unhealthy on those parameters. The next component of metabolic syndrome are high serum triglycerides. So what happens? The glycogen stores are full. The excess glucose causes DNL. There's lots of fat in the liver. You get fatty liver. The fat flows out from the liver because it's trying to get desperately to get rid of it. So you get lots of triglycerides in the blood. Also, triglycerides are exported as VLDL particles, but a lot of them unload their triglycerides onto your hips and so on, and you're left with lots of small, dense LDL particles, the dangerous ones, the so-called bad particles in the LDL, the ApoB. But that is not caused by eating fat, that is caused by eating sugar, as you can see. The next component of metabolic syndrome is a low HDL, a low good cholesterol in the blood. Why does that happen? Well, you've got a lot of VLDL triglyceride particles in the blood, and they activate certain enzymes which inhibit HDL formation. So when you're looking at a lipid panel, these are the 2 most important values: the level of the triglycerides, the level of the HDL, and more importantly, their ratio to each other. And a ratio of 1 or less is ideal. The next component of metabolic syndrome is high blood pressure, and this is caused by high insulin. Insulin has a number of ways of raising your blood pressure. It increases the heart's contractility. It facilitates sodium retention in the kidney and stimulates ADH. It directly constricts blood vessels. It's also toxic to the liver, which excretes uric acid, which inhibits nitrous oxide. Nitrous oxide is a potent vasodilator. So insulin inhibits that. The next component of metabolic syndrome is hyperglycemia. We've already said how this goes. Excess sugar, high glucose, high insulin. High insulin leads to obesity. You get de novo lipogenesis, fatty liver, insulin resistance, no inhibition of glucagon, gluconeogenesis and glycogenolysis goes on unabated, and you get hyperglycemia. And then also you get a toxic pancreas, and the insulin can no longer be produced, and that's when you get a diabetic crisis, where you seem to suddenly develop diabetes, although it has taken years to develop. Diabetes damages every organ in the body, and it does that by damaging the endothelium of blood vessels. We are told that bad cholesterol, if you get a high level, it gets into the blood and somehow damages the endothelium, but that's not what happens. What actually happens is that glucose damages the endothelium. It does this by many mechanisms, by reactive oxygen species and oxidation, but what basically happens is it gets into these flat endothelial cells. The cells get toxic, they swell up, spaces develop between the cells, and you get leakage. As soon as you get leakage, the clotting mechanism is activated. Hence, on a CAT scan, you see calcium, which is the 4th element in clotting. As soon as that little area between the cells clots, you get an inflammatory response. It brings along some LDL to try and seal off the leak. So LDL is just the marker of damage. It's not the cause of damage. So really, sugar is what causes this whole atheromatous damage to the endothelium, and damage to the endothelium in small blood vessels, disrupting them and so on. The other molecule that we know does exactly this is nicotine. So let's first have a look at the microvascular damage that diabetes causes, and then we'll look at macrovascular. So here in the eye, you get microaneurysms, you get damage to these small vessels, you get bleeding, you then get infarction of some of the nerves. They are seen here as these cotton wool spots. And diabetes is the leading cause of blindness in adults. Diabetic nephropathy, the same sort of damage goes on in the little blood vessels in the kidney, and renal failure and dialysis. Leading cause again is diabetes. Peripheral neuropathy with sensation loss and ulcers and diabetic foot pain, arthritis, diabetic ulcers, also a big problem with diabetics. Similar things go on in the large vessels, and in the heart vessels you get heart disease. You're 4 times more likely to die of a heart attack, and 68% of 65-year-olds diabetics die from a heart attack. The same thing goes on in the vessels in the brain, and strokes are increased by 400%. Peripheral vascular disease is the leading cause of non-traumatic amputations, and diabetes is the leading cause of this. Alzheimer's disease is just a chronic glycosylation of nerve tissues, very common in diabetics. In fact, it's now being called type 3 diabetes in some circles. Depression, cancer, there's a marked increase risk in the so-called sugar cancers, colon, stomach, pancreas, prostate, breast, and endometrial cancer. Erectile dysfunction, skin tags and other skin problems, nail problems, PCOS and infertility, polycystic ovarian syndrome can often be reversed by a low carbohydrate diet, uterine fibroids and endometriosis. So knowing all this, let's have a look how not to treat diabetes. So in type 1 diabetes, it was clearly shown that you control the glucose, bring the HbA1c down, and the complications go down. This makes sense because vascular endothelial cells do not need insulin to take up glucose. So the less glucose in the blood, the less the endothelium will be damaged. In type 2 diabetes, it's completely different. There's at least 7 randomized controlled trials. Here I've named them, that show that the complications of diabetes actually get worse if you control the sugar by using exogenous insulin. And that makes sense because you're not solving the sugar problem, you're just moving it from the blood inside the cells. You've still got glucotoxicity. In fact, you've got it worse. So to treat a disease of too much insulin with injected insulin makes absolutely no sense to me. So continuing how not to treat type 2 diabetes, let's have a look at the oral hypoglycemic medicines. Well, the sulfonylureas stimulate insulin. They have all the problems of injected insulin, weight gain, and they do absolutely nothing to lower your insulin. The TDZs, they increase the insulin sensitivity in your fat cells. So you get fat, it worsens metabolic syndrome. Not a good idea. The DPP-4 inhibitors, they block the incretins in the stomach, the breakdown of the incretins in the stomach. So again, you get a raised insulin. Metformin, one of the better ones, inhibits gluconeogenesis, but it doesn't reduce your hyperinsulinemia. And most diabetics go on to metformin, and they just go up and up in their dose until they finally have to use insulin. The SGLT2 inhibitors, at least they have some logic. They get rid of glucose in your urine. You may get UTIs, and DKA is a problem, but generally they are doing what you should be doing, which is eating less sugar. They are just expelling it in the urine. So what about a low-fat, SAD diet, standard American diet? 60% carbohydrates, and the belief is that you have to eat carbs, and that is at the root of all evils. You do not have to eat any carbs. There are essential fats, there are essential amino acids, but there are no essential carbohydrates. So the dietitians will tell you to eat many small snack meals a day just to keep your sugar up and your insulin up. And I don't see the logic in that. Keep your sugar up, keep your insulin up. Diabetes is a disease of too much insulin. So this is almost a no-brainer, akin to saying keep your insulin levels up for as long as possible. So here's a slide from one of Professor Tim Noakes' talks, which just sums it up. Jane, I'm afraid your mother has diabetes. We can cure her with a simple low-carbohydrate diet. However, the guidelines tell me I must prescribe pills, insulin, and loads of carbohydrates. So her condition will just keep getting worse. Sorry about that. And he doesn't mention that he's worried about being punished for treating people like that. So how do you effectively treat and reverse type 2 diabetes? Well, you go on a low carbohydrate, high fat diet, you do intermittent fasting, and you get off all your drugs. The idea is, have a look at this. This is insulin levels when you eat 3 times a day, twice a day, and once a day. And you can see what you eat will stop that insulin from going up high. But if you really want to lower your insulin, you have to do some sort of fasting. This video is not about the treatment of insulin, diabetes. It's just the general principles. But I'll give an example of a case. So this is an example of a man. John was 71. He was diagnosed with type 2 diabetes 10 years ago. He had high blood pressure. He had a stroke, peripheral vascular disease, and chronic kidney disease. His HbA1c was 8.4, and he was on 36 units of insulin a day and 2 oral hypoglycemics. He was on 2 antihypertensives and a statin. So he went on to a ketogenic diet, less than 25 grams of carbohydrates a day. He fasted for 24 hours, 3 times a week. And on his other days, he did a 16-8 fast, and he did this for 6 months. Within 1 month, he was off insulin, and within 6 months, he stopped the oral hypoglycemics and blood pressure drugs. The statin, of course, was removed on day 1. So what happened? So he lost 7 kilograms, and his waist size decreased by 12 centimeters, indicating he's reversing his fatty liver and fatty pancreas. His HbA1c after 6 months was 5.4%, and his urine albumin to creatinine ratio dropped by 2/3, which means that his kidney function was vastly improved. So these are just the principles of treatment. I will do another video on the more detailed treatment, but in fact you do need your doctor to help you get off your insulin, your oral hypoglycemics, and your antihypertensive medications to avoid hypoglycemia, hypertension, and other complications. So thank you for listening, and I'll see you in the next video. Bye.